My interest in podiatry and foot and ankle surgery specifically is ankle and rear foot reconstruction. That can be necessitated for many reasons. Most commonly, it's some sort of arthritic condition of one of the joints, some sort of trauma that led to fracture that maybe didn't heal in the perfect position and leading to other problems down the road. Many of the reconstructive and revisional type of surgeries that we do, or the most common ones, are fusion procedures where we place two bones that were part of a joint and place them together and make them one bone. We do it quite often in the ankle, the subtalar joint, which is the joint just below the ankle, and some of the other joints just as in front of them as you move towards the toes. The recovery for one of those types of procedures that unfortunately are fairly lengthy because there's a prolonged period of non-weight bearing that can be up to a couple months if necessary. But then once it's fused and solid, there should not be any issues with it after that. It's a common concern with these fusion procedures that you won't be able to do what you were doing before. And in some ways that is true. An ankle fusion does limit a lot of the motion that you used to have, but there are many joints in the foot that can make up for some of that loss. You're not going to be able to go out and run marathons on an ankle fusion. But if it relieves the pain, it's well worth it. The most common demographic for these procedures are more elderly patients, but not always. If some sort of trauma or bad fracture led to this, they can develop these arthritic conditions at a much younger age. If we're talking specifically about an ankle fusion, there are definitely many steps and treatments before we get to that point. Some of the conservative treatments would be trying an ankle brace or some sort of device that will sort of lock up the ankle so it doesn't move very much, and it essentially simulates a fusion. And by doing that, it can relieve a lot of pain. We can try corticosteroid injections into the joint to try to relieve any inflammation, and they usually help quite a bit for pain. There are also some less invasive surgical options than the fusion. You can try ankle arthroscopy, where you go in with a camera similar to a knee or a hip or a shoulder, where you can kind of clean up the joint and take away some obvious issues. It's not going to be a long-term fix, but it can obviously give you some relief.